a video if you've had recent knee surgery or knee reconstruction, or you've got a scar on the knee or scar somewhere on the leg and it's feeling quite tender and it's feeling quite inflamed and you may have some swelling. Lymphatic drainage can be very good to help with that, with deflame the tissues. And then if there is any sort of edema or anything after surgery, it will help the healing process just sort of take out some of that swelling, keep the area all nice and soft, and it will give you a lot of relief from the pain. So first of all, we're going to do some lymphatic pumping. I'm just going to take this very quickly, and then we'll get to the actual lymphatic drainage of the legs. So first of all, you're going to pump the nodes, the ducts just above your collarbones in that little triangle there. So you're going to just do some gentle on-off pressure there while taking some big belly breaths, just to open up the whole sort of lymphatic. These drain the lymphatics for the whole body. So pumping that for about 10 times while taking big belly breaths. You're going to pump underneath the armpit, squeezing gently into the midline, on-off pressure, 10 times. The other side, I'm going through it a bit quicker than you normally would. The side, belly breaths. You're going to also pump in the corner of your panty line here. You've got the inguinal nodes. So you're going to do a sort of wavy, I'm doing it with that sort of paddle of my hand, on-off pressure 10 times. You're going to squeeze just underneath your rib cage with the breath, just little sort of pumps into the midline and off each side of the rib cage, just underneath the rib cage there. Nice breaths. Now inside that hip bone, again, little squeezes to the midline, little sort of pull of the fascia there, 10 times, and again, you can just do it 5 times if you want. Okay, now we're just going to do a few little belly breaths, which helps ignite all the deep lymphatics in the tummy, which is going to help the swelling come up from the legs. So in the same positions that we did before, we're just going to go breath in, into your hand, breath out, push into the belly, follow yourself in, breathing in, pushing against your hand, and breathing out, pushing your hand in. Next spot, same spot, just underneath that rib cage, breathing into your hand, breathing out, pushing in, breathing in, pushing against your hand, resisting slightly, and pushing out. And the same for the other positions, just in front of the hip bone, breathing into your hand, breathing out, pushing, following it in with your hand, and then on the next in-breath, you're going to resist with the hand, and following it back in. And the same the other side, breathing into your hand, breathing out, following it in, and when you breathe in again, resisting slightly, but just let your breath in, and then breathing out, following it in. Okay, so we've opened up all the channel now, and now you're going to do some lymphatic drainage. I'm just using an example of a knee scar. So we're going to start proximally and work distally. So this is like a full car park of cars. You can't drain any of these cars until these cars have moved out. They only exit out of the car park up here. So we've done our pumping in the inguinals. Now you're going to do this on skin. Obviously I'm not going to show you on my skin here, but so it's a bit of a draggy move. We're going to start at the top and work backwards. So always towards the heart, always towards the inguinals in this case. All right, you're going to engage the skin, drag the skin up. All right, so you're bringing it into this channel here. You're working in the top section first, sort of probably 3 strokes in each position, side of the leg, bring it up. Nice and slow, dragging, no cream, just straight on skin, just dragging the skin up. Okay, then you're working down next sort of next third of the upper leg there, bringing it up on the inside, bringing it up on the outside, probably 3 times each there. Then getting down to above the knee, again dragging nice and slow, bringing the side of the leg up and around into the inguinals or the iliac nodes. Okay, bringing it up, so always working towards the heart, but just working backwards. So we're getting further and further down the leg. Okay, then you do behind your leg. So bringing the back of your leg, you're sort of bringing it up and around. Scooping and bringing up. Scooping and bringing up. So I'm like pulling it like that up. Okay, and then full strokes. Okay, you've got your knee. Alright, bringing the knee up and around. If you've got a scar, mobilise the scar a little bit. Bringing it up and around. Doing some pumping behind your knee. You've got some lymph nodes behind the popliteal there, behind the knee. So doing just like a little water wheel, on and off pressure there, just to drain the calf. And then, you know, bringing the knee all the way around. Okay, and you can go down as far as you want if you feel the shin and the calf's involved. I'll just open that up a bit. Okay, but if it's just the knee, unless you've got any swelling in the lower leg or calf, you can do it all if you want to, if you've got time, around the ankle, around the foot, if you've got swelling in the foot. You know, always working backwards. Excuse my dog, yet again. Okay, bringing up the calf, pumping behind the knee, taking a nice belly breath, and then bringing that all the way back up. Okay, and then long strokes all the way up, all the way up. It's nice when you do get somebody else to do this for you, but if you don't have anyone else at your whim, then you can do it yourself. Okay, bring in the hip. Again, same thing if you've got hip pain, bringing all that around from the hip and into, this is where they drain into these nodes at the front. Okay, so then you're going to do your pumping at the end, pumping in the panty line. And then just finishing with some breaths. Deep breaths again, same like you did before. Breathing in, breathing out, following in, resisting on the next breath in, and pushing back in. So 4 stations, and then again pumping those major ducts above your collarbones. Alright, so give that a go. That really will help deflame the tissues and help with pain from recent surgery, or if you've got any swelling in the legs. Okay, thank you. Bye.